Okay, supplemental security income, SSI, an overview of benefits and work incentives for people with disabilities, webinar on Wednesday, July 20th at 10 a.m. with Richard. The ARC's disclaimer, the ARC of Lehigh, Northampton County's advocacy department does not employ lawyers nor provide legal advice. This training or any provided by the ARC advocacy department does not constitute or imply the endorsement, recommendations, or favoring of the providing party or any employees or contractors acting on its behalf. This webinar is being provided for educational and informative purposes only.
Well, good morning again, everybody. Hope you're doing okay. Pretty hot out, but I hope I have some hot information for you here about the SSI program. So I'm going to start with saying what I said last week for that session, in that we're going to go over a lot of aspects today of the disability program here. Do not worry if you don't get every single thing exactly today, because between our website and speaking with us directly, either by phone or in person, you should be able to pick up anything that you may have been a little bit unsure of. So it's a lot. So just take it in as we go. So we're gonna start. Kodi, go ahead. You can go. So today, these are the topics we're going to cover in this order. We're going to talk primarily about the Supplemental Security Income Program, which is SSI, and we're going to talk about disability benefits within that program. We're going to discuss the eligibility factors for SSI disability and go over the application process. So that's kind of like the basics of the program and how you get going. And then we'll talk about a person working while they receive SSI, the work incentives program that's available to them, which is a good program to allow them to work and not fear immediate threat of losing either cash benefits or health coverage. And then we'll close with the ticket to work and Q&A along the way, however you want to do it. So go ahead, Kodi. Now, folks, this is a slide that I stole from somebody else. This is the first time I'm really using this. I mean, and I just wanted to make the point here before we get into SSI completely, is that at Social Security, we have two disability programs that we administer. One is the Social Security itself, SSDI. Most people are familiar with that. You know, the Social Security program overall includes retirement and survivors benefits in addition to disability. And then the SSI program, Supplemental Security Income. But you may deal with the Social Security office along the way, and you may encounter an employee who uses jargon, and sometimes that can be confusing to the layperson. So I just wanted to put this up here that the Title II and the Title 16 that you see here at the top refers to that section of the Social Security Act. So Social Security, SSDI, and retirement and survivors on the left is under Title II of the Social Security Act. That's the provision that establishes those programs. So sometimes you could be dealing with somebody in an office, one of our employees, who says Title II, and just so you know exactly what he or she is referring to, Title II is a reference to Social Security. It's commonly used within our employee base and talking to each other. And Social Security, you get Medicare with that for disability. SSI is under Title 16 of the Social Security program, because SSI only came into being in 1974, whereas Social Security itself, the disability program, began in 1956. So you can see, you know, these are the titles that are added onto the Social Security Act, the provision. So SSI is referred to as Title 16, and you get Medicaid with SSI. So I'm not giving this to you necessarily for you to be an expert in all the provisions of the Social Security Act and all that, but just sometimes, so you know, you're on board with exactly what a Social Security person might refer to and using jargon, which they really shouldn't be doing, but they might do it. So Title II is Social Security benefits, which we talked about last week, and Title 16 is what we're talking about today, SSI. So that'll kind of, you know, that'll show them too that you're keeping them on their toes if you know the inside lingo on this. So that's what that slide is about. So go ahead, but that's not really, you know, the heart of what we're going to talk about here today. So go ahead, Kodi, go next one. So the Supplemental Security Income Program is a program that's based on need, and it provides a cash benefit every month on the first day of the month. And in Pennsylvania, if you get SSI cash benefits, you automatically get Medicaid from the state with it. The state accepts our ruling that this person is approved for SSI, and no questions asked, you're going to get Medicaid with it. So within SSI, there's basically two categories of recipients. One are people who qualify on the basis of age, being 65 or older. There's no disability involved there. It's just a matter of being a certain age. We're not talking about those folks today, but we are talking about people who are under 65 who are disabled, and whether they be adults or whether they're children. Unlike Social Security, there's no work requirement for SSI. It's strictly a needs-based program. So there's no issue of how long you work and when you work like there is with Social Security. If there are some people from last week, they'll remember that. We talked about that. And for SSI, as we said, it's a needs-based program. So the person has to meet certain income and what we call resource limits or asset limits. And we'll go through that. And living arrangements are a factor of entitlement. You know, are you living with somebody else? Are you paying rent? Are you living rent-free? Are you in some type of facility? All those things come into play in determining whether you can get SSI. And in Pennsylvania, the state may contribute some additional money to the federal benefit, which SSI is a federal benefit, but the state of Pennsylvania usually contributes some additional money in a separate check. Now, how much do people receive on SSI? SSI, first of all, folks, is a month-to-month calculation. So whatever you're paid in a particular month reflects what income and assets you have for that month, okay? So SSI, the maximum federal payment for SSI right now is $841 a month. But that's if the person has none of what we call chargeable income. They basically don't have any other income, and they satisfy certain requirements that we're going to talk about. So the maximum payment is generally $841 a month, okay? If the person has some chargeable income, meaning some other income, which is going to count against that $841, between that other income and the SSI payment, it'll bring the total to $861, which is $20 higher. And that's because there's a $20, what they call a $20 exclusion, whereby if you have some other income, okay, you're not going to get the full rate of SSI 841, but your total is going to be calculated to be 861. They sort of give you a break on $20. So for instance, if someone had $600 in other income, that would result in an SSI payment of $261, which brings you to an $861 total. And you see that's $20 more than the standalone federal maximum of $841. So generally, you know, if you're talking about somebody, can they qualify for SSI? You're kind of safe to say even $861 is sort of the cutoff, okay? Now, one of the things that with young people has to be taken into consideration is a principle or a principle of the law called deeming. So I don't know, maybe we should have asked if folks have children under 18 or children, or strictly dealing with an audience that has children 18 and older. But if a child under 18 is applying for SSI or is going to receive SSI, if that child lives with one or both parents, then the income and assets of the parents are considered in determining whether this child can receive SSI. So, you know, the theory is that a parent who has a minor child has their responsibility to support that child. And obviously, if there's other children in the family, support all the children, you know, in total. So there is some allowance for overall situation with multiple children, even though they might not all be applying for SSI. So parental income based on need, for instance, public assistance, that does not count against SSI. It would not be any type of countable income, all right? But if the parent works or the parent has some type of benefit that they receive, then that'll be figured in the mix for situations where the child applying for SSI is under 18. This provision called deeming, this stops the month after the child turns 18. So let's say today's what, July 20? So let's say a child's on SSI. He's having a birthday today. He's turning 18 today. Starting with the next full month in August, then at that point, the child's will be looked at individually for their own income and assets. And whatever the parents have would not be a factor any longer. But up until the month the child turns 18, if the child is living with the parents, then their income and assets are a factor. If the child does not live with the parents, then it doesn't matter what the parents have. So if they say a child's living with a grandmother or grandfather, then we just look at the child individually, not in terms of anything that the grandparents might have or parents live elsewhere might have. Okay. So I don't know if in this audience predominantly kids who are 18 and older, or there are some folks who have children under 18. So that's what this is about. So go ahead, Kodi. And just one last thing on this deeming of income from the parents for children under 18. As I mentioned before, there's a responsibility that parents have to support all the children who live with them. So let's say there's 4 children in the household and 1 child is applying for SSI, and the parent works or has some type of income. We will consider the fact that, okay, not only does this parent have to support the 1 child who's applying for SSI, but the other 3 as well. So therefore, the parent's income is sort of spread out, and therefore would not impact the 1 child applying for SSI as much as if there were no children there. Then everything would fall on the child who's applying for SSI. So just to give you an example of how income affects minor children, if you had, for an example, a 1-parent household, and that parent was working, and the only child in the household is going to be on SSI or applying for SSI. If there's no other children in the household, then the monthly earnings limit for earnings now for this single parent would be $3,209 per month. So that comes out to about $38,000 in a year if the parent's only income was from work. Now I'm saying $38,000 for the year, but all the calculations are done month to month. But just to give you a sense of what that represents, if you're looking at a yearly basis, it's about $38,000 or so. If there's another child in the household who is not applying for SSI, so you have 2 children, 1 applying, 1 not, then the earnings limit goes about $300 and some for every additional child. So now we're talking, if there's 1 other child in the household, the earnings limit for that 1 parent is $3,595, which is about $40,000 or $41,000 for the year. So as there are more children in the household, then obviously the limit for the parent changes. And if there's 2 parents in the household, then the limits are even higher because they're accounting for 2 people work. So just wanted to give you a sense of income for a child under 18. Income is looked at not only for what the child might have or may not have, but especially for what the parent has. Okay. And we mentioned that SSI is a 2-pronged process in terms of looking at what the income is and looking at what the assets are. So we call assets resources. What are they? Well, basically there's any cash that the person might have, the family might have, or anything else that could be liquidated and turned into cash pretty easily. Bank accounts, bonds, stocks, anything like that, any type of investments, they count as resources. Non-home property, what that means is if the parent, let's say, owns the house or is paying a mortgage on the house as well, then the value of that house does not count towards any type of asset limit. If the parent owns a house elsewhere, so they're living in house 1 and they have house 2 somewhere else, then house 2 is going to count in terms of its fair market value. And a lot of times that makes a person ineligible for SSI because of the property value of the other home. But if there's just 1 home involved, doesn't matter, how magnificent that house might be or whatever it might be worth, it doesn't matter. And the resource limits are not very high. So the person applying for SSI, whether it's an adult or a child, has a $2,000 limit on savings. Okay, so money in the bank, let's say, is most common. And in cases of a child under 18, not only does the child have a $2,000 limit, but the parents, whether there's 1 or both in the household, they have an asset limit as well. So a lot of times we have a single parent with 1 child applying for SSI. So that household would, in a sense, have $4,000 of resource allowance. So $2,000 for the child, and in almost all cases, the child doesn't have any assets. But the parent would have $2,000, and if there's no assets for the child, we would sort of combine the 2 and make it a $4,000 limit for the parent. And then if there's 2 parents in the household, the parents have a combined limit of $3,000 added onto the child's 2. So, and this is a month-to-month proposition. So we count assets or resources as of the first moment of each month. So, we're looking at coming up now, like the very first moment of August, how much are there in resources? Then we go to September and so on. So that could change month to month, okay? now we're going to look at the definition of disability. And this first definition is for adults. This would be anyone who's 18 or older. This would apply to Social Security disability as well. But the person has to have a physical or mental impairment which is expected to last or has lasted 12 months or result in death. So if you're talking about a physical disability where somebody had an accident or some type of trauma or whatever, then there's usually an onset, a beginning date for that type of situation, a traumatic incident. So they would say, okay, you got injured in April of 2022. This condition in theory has to last till at least April of 2023 to be considered an allowance. Now, for someone who's maybe born with an intellectual disability or a younger person that has that type of disability, that's obviously going to be with them, then they would meet that requirement. But in addition to having the condition that's going to be of a certain severity and last at least 12 months or result in death, the condition for an adult has to prevent the adult or the worker from engaging in what we call substantial gainful activity. So again, we talked a little bit at the beginning about jargon. And if you deal with Social Security enough, a lot of times you're going to hear that term SGA thrown around. And that's referring to substantial gainful activities. So the next slide goes into this a little more detail. SGA, or substantial gainful activity, basically what is that? It's kind of a weird term, but breaking it down, the gainful activity part is working for pay, whether you're working as an employee or whether you're self-employed, you're doing work, and hopefully you're getting paid. So to be considered substantial, that's a relative term, of course, but this year we define substantial in terms of earnings as earnings of at least $1,350 a month. Those are gross earnings. So what that means is that you could have a person, let's say the person has a physical disability, and the disability in and of itself medically would be severe enough to meet our requirements, but the person is pushing themselves and going to work, and they're toughing it out and they're making $1,350 or more a month. Well, that person would be denied if they filed a claim because the work they're doing is considered to be substantial. If that same person would drop their earnings down below $1,350, let's say they cut back their hours or even if they stop working, whatever. Now, with that condition, the medical condition, they're going to be approved most likely, okay? So a lot of times you'll hear, again, I'm going to say sometimes you're going to hear even some of our people say, well, you have to be totally disabled. Well, to me, when you say somebody's totally disabled, that means maybe they can't do any work at all. And that really is not the defining aspect of Social Security disability. It's just that you can't be doing substantial work, okay? And this is for when you first apply. Things will change. We'll talk a little bit later on about working while you're receiving. But in order to get on in the first place, you have to meet this definition. You have to have that condition which is severe enough and it's going to last at least 12 months. And it's preventing you from doing substantial work, okay? So just keep that figure in mind, $1,350 a month. That figure changes each year. In October, when they announce the cost of living adjustments, they're going to announce what the new SGA level will be for 2023. I mean, generally this goes up about $500. I'm sorry, it goes up a small amount each year, not $500. It goes up. It could go up $50 or a little more, whatever. So we'll see. Now, one of the things that, and let me say this. Let me just back up too. We had the definition of disability for an adult. Have to have this condition last at least 12 months, projected to anyway, and not be performing SGA. If you're talking about a child under 18 applying for disability, okay, and I don't know again if our audience today has children under 18 who haven't applied yet, but if they have and are under 18, the definition for a child is different. The definition for a child for disability is that we would look at how the child's disability impacts their day-to-day activities, and they would in essence be compared to children who are unimpaired, who are of their same age range. So let's say you had a 16-year-old child who has a disability. It's not a work issue because children almost always are never working under 18. But the issue is comparing that child to another 16-year-old who does not have any type of impairment. How are they able to get through the day and do the different things they have to do, dressing, eating, just doing work and working in terms of little errands or things like that, or what is their ability? So it would be a little different than for a child under 18. But I think my sense of the audience here today is most folks have young people who are 18 plus, okay? So the onset date of disability is something else you might hear. And what this refers to is the earliest date the person's medical condition meets the requirements, okay, it's of a certain severity, and the person was not working above the SGA level. So for instance, I gave you that example of somebody who has a physical condition and they're working and they're pushing themselves maybe, and they're toughing it out and they're working and they're making earnings above the SGA level. Well, that's going to knock them out of the box if they would apply. But if they would, let's say come September, they say, I'm cutting my earnings down, I'm only going to make $1,100 a month. Well, then that would be the month, November would be the early, or whatever month I said, September or whatever, would be the earliest month they could be considered disabled. And that would be the onset of their disability when they stop working at the SGA level. Okay, so that's what we're referring to here, meeting both ends of this definition. If somebody needs to file for SSI, okay, you can file for SSI in one of three ways. You can do some of the SSI application online at our website, ssa.gov. And that portion is the medical portion. You can provide the information about, this young adult's medical records, where are they kept, who has evaluations on the child, the young adult child, things like that. You can do that portion completely online. That gets the ball rolling. The non-medical portion, however, will have to be completed a little later on by someone from the local Social Security office. So they're going to be asking the questions about what income does the person have, what do you have in assets, who lives with the child, the young adult child, things like that. That will be done, I don't know, maybe a week later, I don't know, whatever, depends on the local office schedule. And that would be done either by phone or in person. So you do part of it to get the ball rolling, and then the non-medical will have to be done by a contact from the local office, okay? Now, if instead of doing that online, if the person says, I don't want to bother with that, let's just do the whole thing directly dealing with the local Social Security office, then you would call our national 800 number, the toll-free number at 1-800-772-1213. You talk to a person there 7 to 7 weekdays, and they'll set you up with an appointment. They'll say, okay, the Allentown office is going to call you on 10 o'clock on Tuesday morning, or you'll go into the Allentown office on that day, whatever you prefer, either to do it in person or to do it over the phone. And sometimes they send, depending upon the time frame of when the appointment's going to take place, sometimes they'll send a disability starter kit in the mail. That's something with some additional information we would need. I don't know if they do that as much anymore, but so whatever they do, if they ask for that, complete it. If not, you can wait till the appointment itself. Okay. So the application has been filed, and what happens then? Well, who makes the decision on whether the young adult child is considered disabled or not? Well, it's not done by the local office. It's done by employees of the state of Pennsylvania. We have a contract, Social Security does, with the state of Pennsylvania, and they make the rulings on our disability claims. It's called the Disability Determination Services Site, commonly called DDS. It's another phrase you might hear a lot. DDS, they make the medical determinations. So in Pennsylvania, there's one in Harrisburg, there's one in Wilkes-Barre, and there's one, I believe, in Greensburg, although locally, most of the claims would go to the Harrisburg or Wilkes-Barre site. And those are the folks there, a disability evaluation specialist who works for the state, a physician, are going to go over all the medical evidence, and they're going to make the ruling. They're going to make the determination. Average processing time is like 90 to 100 days or so. It could be a little shorter, could be a little longer. It sort of depends on how quick we get the medical information and stuff like that. And then, the local office would be notified as to what the decision is. If the SSI claim is approved, so it takes a couple of months, they send a notice back, tell the local office, hey, John Jones's claim was approved. At that point, the local office is going to take steps to start to pay the individual. And benefits are usually retroactive to the effective date of the application. Now, you see, effective date is underlined, and that's for a reason, because the effective date of an application depends on when you or the person or the family made the request to have a claim filed. So the way it works is that if you called us today and said, hey, I want to have a claim taken for my son, today's July 20th, the effective date of an SSI application is the next month, is August 1st. It always goes to the next month. So why is that important? Well, that's important because, and good for you to know, Because if today was July 30th instead of July 20th, and you said, you know what, I got to call Social Security, I want to set up a claim. I'm a little tied up here, I'll do it next week. Well, if this was July 30th and you said, I'll do it next week, now next week is August. And at that point, if you contact us in August, it's going to revert to September. So you potentially lost a month's worth of benefits, both cash benefits and Medicaid. So the point here is that if you want to have a claim taken, or you want to request one, don't delay. Now look, if today was July 10th, it wouldn't matter if you waited till next week, the 17th, or even later. But the point is, you don't want to go into the next month. You don't want to delay. And if the claim is approved, as it says here, Medicaid from the state of Pennsylvania is automatic. It's going to coincide with the benefit entitlement month. So there's no worry about having to do anything else with Medicaid to get that going. It should just be automatic. In some states other than Pennsylvania, you do have to do something else besides just getting the approval on the SSI. There is some things, paperwork and things have to be done with Medicaid. But here, it's an automatic. It should just happen along with the processing of the claim. If the claim would be denied, you're going to get a letter in the mail that's going to say you have 60 days to appeal this. And it's going to give an explanation as to why the claim was denied. You know, they feel that, you know, the young adult is able to work because of this or that, whatever it might be. Conditions not severe enough, whatever it might be. You have 60 days to file the first level of appeal, which is a reconsideration. A reconsideration is where we get some new information from you, and then that information goes with the initial information goes back up to the DDS, and people at the state who did not work on the first decision, a new set of eyes will look at it and make a ruling on the reconsideration. So that's going to take a while too. It's going to take a couple months. If the reconsideration is denied, you have other appeals remaining. You can file a hearing. That's the next step before an administrative law judge. And that's going to take a number of months. If that's denied, you can also file what's called an appeals council review. That's down in the Washington, D.C. area. You do not have to go there, but that's where it will be held. And then if that is denied, which we're talking now a good bit of time, it would have passed here, you can actually file a lawsuit in federal court. So these are the levels of appeal. Now, it's important if a claim is denied and you think obviously the decision was wrong to appeal it because it keeps the claim going. So if your application was taken in April of 2022, claim was denied in July, if you let more than 60 days lapse and you come in October, well, then we're starting over with a new claim with a new application date. Whereas if you keep the thing going, keep the claim active by filing an appeal, most likely, if you're going to be approved, they're going to take it all the way back to the original application date. So that's the advantage of filing these appeals rather than letting them lapse, okay? So we're going to talk now about working and receiving SSI at the same time. This is the Work Incentive Program, and then along with that, we're going to talk a little bit about the Red Book, which I think is a good publication for you to have your hands on. And then at the last part, we take it to work. But the Work Incentive here, I think is the most important thing coming up here. So somebody who's getting SSI now, you've been approved and you're getting SSI. The good thing is, you have a lot more leeway about working after you get on the program. Whereas when you first start and apply, you have to be wary of that $1,350 SGA level because that's the determining factor. If you're going over that initially, you're not going to get approved. But once you're on, SGA is not an issue anymore. It's sort of a math game at this point. We don't really care whether you're 1350 above or 1350 below. That's really not an issue. You've satisfied that requirement to get started on SSI. Once you're on, it's just a matter of if you get a job, how much are you making and how much of a hit are you going to take on your SSI based on your earnings. So earnings are going to reduce payments in most cases, but benefits are going to continue as long as certain overall income and resource limits are not exceeded. Okay, so let's go to this next one. You're going to see we get started here. It's a pretty good computation here for the person, okay? So, how do earnings reduce SSI? Well, you see the first bullet. It says, unlike unearned income, earnings don't reduce SSI dollar for dollar. So what that means is that unearned income is just that. It's income that the person is not currently working for. So let's say you're getting a person would be getting a check, and not so much young person, but let's say an older person, older adult on SSI, they might be getting a pension from the VA, Veterans Administration. And it might be $500 a month. Well, pretty much that's going to reduce their SSI by $500 or so, minus the $20 exclusion. It's pretty much a straight subtraction. Working is not like that. You have a lot more leeway. So it's good for you to know this formula. So the second bullet, the first thing we're going to do when somebody has earnings in a month, again, every calculation is month to month. We're going to take either $65 or $85 right off the top of their monthly gross earnings amount. The reason I say it's either 65 or 85, it will be 65 if the person has some other type of income. Like I mentioned, they're getting some unearned income because the $20 exclusion is applied to that unearned income. So if it's a pension check, you're going to take 20 off of that. And 65 will be left to be subtracted for the work calculation. If the person doesn't have any other income, then the exclusion is going to be $85 because we'll put that $20 onto the 65 to make 85. So if the person just was getting SSI and went to work and had no other income, we're going to take $85 off the top. And after we do that, whatever's left over, half of it's going to count as income against SSI. So in the left-hand corner, you see here, you have a person on SSI, they get a job, they make $600 gross. We're talking before taxes, gross in a month, 600 bucks. They're going to have an $85 exclusion. So we take 85 bucks right off the top, which leaves 515 remaining. Half of the 515 on the right side is 257.50. That's how much their SSI is going to be reduced for them earning $600. So in the total here, okay, in the total, they're losing 257, but they're picking up, you know, 300 and some dollars in terms of earnings, if you want to look at it that way. And I understand there's taxes there, but everybody who works has to pay taxes. So the bottom line is that their total income overall should be higher working as opposed to not working, okay? So just remember that formula for SSI. Going to take the gross earnings in a month. If you get paid twice, you just add those two checks together in terms of the gross. Take either 65 or 85 off the top. If they have no other income but work, you just take 85. Whatever figure you get then, cut that in half, and that's how much the SSI is going to be reduced. So $600 in earnings results in a $257.50 reduction. Now, how much would a person have to earn in a month to completely knock them out of the box of getting any SSI? Well, if we say the person has no other income but their earnings, then the earnings limit right now is $1,767. That's going to result, or more, is going to result in them not getting an SSI paycheck, SSI benefit, I'm sorry. So here you go, $1,767 is what this person earned. We're taking the 85 off, that leaves $1,682. Right-hand side, half of $1,682 is $841. $841 exactly zeroes out the $841 amount that SSI would pay as a maximum benefit. That leaves them with zero, which means no SSI payable. So the reason I put this up here is because just goes to show you that a person would have to make that much in earnings to lose their SSI in terms of a cash payment. But even if they lost their earnings because of this cash payment lost their cash payment because of 1767, they would still have the 1767. Of course, again, that's a gross figure. But in theory, that should end up with more net money than 841 on SSI, okay? And then that figure will rise next year because as there's a cost of living increase, these numbers, the allowance is going to go up next year, okay? Because the bottom figure, the 841, is going to go up. Another provision, which is good for the worker, for the person, is called impairment-related work expenses. This helps a person retain more SSI. So remember, once a person's on the program, we don't care whether they're making SGA or not. We just care initially. After that, it's just a matter of how much their earnings are. And this impairment-related work expense provision helps to reduce what we count as income against their SSI. So what it is if a person has an expense that they absolutely positively have to that they're incurring because they need this to go to work. So for instance, suppose a person needs some assistance in the morning getting dressed or whatever. Suppose they need some special transportation to go to work and they have to pay for this out of their pocket. It's not being reimbursed by insurance or anything like that. They're paying for it. But without paying for this expense, without paying for this item, they would not be able to work. So if a person has something like that, we'll take that off the top. So on the left-hand side, you see, I'm going to say a person's going to make $1,400 in a month. Okay. They have $85 taken off the top. That leaves them with $1,315. Right-hand side, they pay $92 a month for certain impairment-related work expenses. That $92 cost is taken off the $1,315, which gives us a figure of $1,223. At that point, we cut that in half. Half of $1,223 is $611.50. $611.50 is what we're going to count for this person making $1,400. Okay. So at the very bottom, the SSI limit is $841. We're going to take the $611.50 off. That means they will still get $229.50 in SSI, plus they have their $1,400 in earnings. Okay. So this is why the impairment-related work expenses, if a person has them, you know, it's something that we're going to ask about and make certain that, you know, is figured into the calculation. Okay. Now, we mentioned that if a person works, we just saw if they make too much to get a cash payment, what does that mean for their Medicaid? Well, it usually doesn't mean much of anything, because Medicaid is still going to continue even if the person is making too much money to get a cash SSI payment. As long as their Medicaid yearly earnings do not exceed Medicaid's Pennsylvania threshold, which for the year is $47,813. So what that means, if the person's projected to make less than $47,813, even if their earnings month to month are too much to allow them to get a cash payment, they're going to keep their Medicaid. So for a person just starting out, that's a lot of money to make when they're just starting to work, let's say, particularly at a young age. So in most cases, they're almost never going to lose their Medicaid. And even if by chance they hit the jackpot and are making more than $47,813 and are able to do that, God bless, they still do not automatically lose their Medicaid. There's an additional calculation that we would get into to see if they can retain it. And even then, they probably could retain it. So having fear of Medicaid being lost because of earnings is something that you should not be concerned with. If the person on SSI is a student, there's special work exclusion rules there. To qualify for this, the SSI recipient has to be under 22 and in regular school attendance. They can earn up to $2,040 a month in terms of having that excluded, with a maximum for the calendar year of $8,230. So this would be taken completely off. It wouldn't count if they're in that situation, under 22 and going to school and they have a job. So $8,230 would be excluded for the year. Then after that, anything above that would be counted. And the most they could take off in 1 month is $2,040. But that's another provision which is helpful to people who are going to school and working at a young age. And I believe this is the last one about the work incentives, is that there's another provision which isn't used very much. It's called the Plan for Achieving Self-Support, commonly called a PASS. This is where somebody who's on SSI, who's working, has a goal, okay? And they're working towards this goal, and maybe they have a job and it's helping them. Maybe they have to pay tuition, so they're working, they're in school for some, it could be a trade or whatever it might be. But whatever they're doing, they're trying to eventually get off SSI and be self-supporting. So in that case, we can exclude certain income and assets and not count them. So for instance, suppose they're making $500 a month at a job, but they're putting $300 every month towards tuition. Well, we wouldn't count the $300 because they have this plan. They're eventually hoping to get off SSI. But it's something that has to be approved by us at Social Security, has to be in writing, has to give a time frame, and you know, it has to lay out something that's reasonable that the person is going to do this. So that's another thing that's available. If a person is working and they have some type of goal in mind, and sometimes even if they have assets over the limit, they can set aside some of that towards this goal. So that's something you can explore with us. It doesn't happen much, but it's a little bit involved, but that's something that is available to the person as well. So that's the work incentives pretty much. Now, one of the things I wanted to mention is a publication we have called the Red Book. And you might be already familiar with this. If so, I apologize. But the Red Book is called the Red Book because it has a red cover. And it's on our website. It used to be available in hard copy in our offices. Now you have to request a hard copy, but it's on our website. So go ahead to the next one. It has all the work incentive information that we talked about here, plus the work incentive information for somebody on Social Security. And if you wanted to order one, you could go to our website under the publications, and on the right-hand side, you see where the red arrow is, it says order. So hit the next one, Kodi. And you can then order the publication. You get in touch with our headquarters in Baltimore, and you can either call them up or fax a request or email them and say, hey, I want to get one of the red books, and they'll mail one out to you. So this is pretty good because it's, it's a pretty comprehensive book. It has all kinds of situations and examples, sort of similar to what we're doing here today, but more detail. So, and you can see it online. I mean, it's a lot of pages to print out online, but you can see it online if you just want to go through it and, take a shot at looking through different parts. Okay. So that's something that I recommend. Go ahead. So the last section here we're going to talk about is the Ticket to Work program. The Ticket to Work program is something that's been in effect for a while now. It's open to anybody who's on disability, both Social Security and SSI, between the ages of 18 and 64. And what it is a person that they're participating in this Ticket to Work can get free employment services, career counseling, voc rehab, job training, job placement, things like that. It's strictly voluntary. The person who's on disability does not have to participate in this. There's no dire consequences. There's nothing that's going to happen negative. It's strictly a voluntary thing. And you can get in it and decide you don't like it and get out. It's not a problem. But it's designed to help people become self-sufficient. Okay, so move towards a goal of getting a job and eventually in time getting off the program. The Ticket to Work is made up of service providers. They're called employment networks. I mean, even though it could be a single company, but they call it a network. I'm not certain why they chose that name, but each entity is called a network. And these are companies that have been approved by the federal government or organizations that have been approved by the federal government. They're going to provide certain services for the individual, either virtual or in person. Okay. And these are public or private organizations that have a contract with SSI. They've been approved. So it's a lot of social service agencies that provide different services for job training and things. The Pennsylvania State Office of Voc Rehab, OVR, also can provide services. Okay. So if you say, okay, I'm gonna hook up with one of these companies, then what are the advantages to the person by doing that? Well, one of the advantages is if they're making what's called timely progress, a person will not be subject to medical reviews. Everybody who's on disability, both Social Security and SSI, from time to time has to have a medical review of their disability to ensure that they still are disabled, that they haven't medically recovered. So, that's always something that's there. Generally, it's either 1 year, 3 years, or 7 years apart. And there always is the possibility that if the person has improved enough medically, we could say, well, they're no longer disabled and they would be taken off the program. But if you were involved with the Ticket to Work, and by making timely progress, it says that basically you're doing what they're asking you to do. You're attending classes, you're completing an educational program, a training program, whatever it might be. As long as you're doing that, you're considered to be, quote, making timely progress, and you will not be subject to these medical reviews. So that could be some peace of mind for people that don't have to worry about these medical reviews, okay? And where do you start with this? Well, there's a Ticket to Work helpline, okay, which you see there. There's also a website called Choose Work, shown there at ssa.gov. And one of the things you can do is use the online Find Help tool to search for employment networks that service your county. So the next page will show that. So you have these companies, they could be local, they could be across the country somewhere, they provide different types of services. So like on the left-hand side, you would do this, Find Help tool here, and you could put in what I'm looking for. I'm looking for voc rehab, I'm looking for counseling, whatever it might be. You can put in whether you want to do it in person or whether you want to do it virtually, and you can put in your zip code and do a search, and then and you do some other things there, some different information, and then it's going to come up with companies in your area that are participating in Ticket to Work, and you can see what they would provide. And some of them are geared towards certain types of disabilities to help people who have, let's say, autism or whatever it might be. So you would kind of be cognizant of that, and you want to align with that. But you can start with one provider. And if it's not working out, or you just feel like, you know, this one isn't for me, you can take your ticket back and you could cast your ticket with somebody else. You can only be aligned with one provider at a time. So that's another thing that people have available to them, the ticket to work. So I think that's the last one,